Welcome back to Have More Babies. As parents, it really feels like we're constantly trying to keep up, doesn't it?
Oh, absolutely.
Especially with children's health, there's always new advice, new research. It can be overwhelming.
It really can.
Yeah.
And in pediatrics specifically, things are moving so fast. Lots of really exciting innovations driving things forward. It's definitely a lot to take in.
Exactly. So for this deep dive today, we've basically gone through a whole heap of information from the experts over at Omega Pediatrics,
Right.
and the idea is to pull out the most important bits, the really interesting developments in pediatric care.
Yeah, our goal is pretty much to, cut through all the noise. We want to highlight the advancements that could actually make a real difference for your child's health, give you a clearer picture of what's coming down the pike.
Okay, sounds good. Let's get into it. I guess technology seems like the obvious place to start, right? It's playing such a huge role everywhere else.
Absolutely. Yeah. Perfect starting point. Let's kick off with telemedicine.
Telemedicine, right? So virtual doctor visits, essentially.
Exactly. And just think about the convenience factor for parents. It's was huge.
Oh, totally. I mean, imagine not having to bundle up a sick kid, sit in a waiting room full of other sick kids,
Mm.
or just the travel time back and forth. Being able to talk to a pediatrician right from home, that's a game changer.
It really is. And it's not just video calls either. Telemedicine also covers things like remote patient monitoring
Okay.
and also the online portals and apps that lots of pediatric clinics are using now. Omega Pediatrics, for instance, uses these quite a bit to help manage care, from a distance.
Right. Making healthcare fit into life, not the other way around.
Mhm.
Okay, so that's remote access for appointments. What about like keeping tabs on a child's health more proactively?
Yeah, this is where child health monitoring comes in. It's a really exciting field. We're seeing more and more wearable tech just for kids.
Like smartwatches?
Smartwatches, yeah, but also things like special clothing or even headbands that have sensors built right in.
Wow. Okay. So not just adult fitness trackers shrunk down. What kind of data did these things track?
They can gather some really useful stuff, things like sleep patterns, heart rate, activity levels.
Hmm.
And get this, there are even smart pills being developed now. Tiny little pills with sensors you swallow.
Seriously?
Yeah. They can actually send data about whether medication is being taken correctly directly to doctors.
Wow, that's pretty incredible. And I think I heard something about using tech to make healthy habits, well, less of a battle with kids.
Yes. Gamification.
Yeah.
That's the buzzword. It's really catching on in healthcare.
Okay.
The idea is to use game mechanics, points, rewards, challenges, to encourage kids to do healthy things like taking their medicine on time or doing their physical therapy exercise.
Oh, I see.
It can turn something that feels like a chore into something, well, more engaging, maybe even fun.
Anything that makes medicine time easier is a win in my book. Okay, so we've got wearables. What about the devices we all carry anyway, our phones?
Right, mobile health apps. They're becoming super important tools. These apps on smartphones, tablets, they put loads of health information right in your hand.
And not just for parents looking things up, I assume. How are doctors using them?
Exactly, it's for the professionals too. Pediatricians, other healthcare providers, they're using these apps, often linked with those wearables we mentioned, to collect and analyze patient data.
Okay.
And a key thing is that this data can often be sent wirelessly. That means quicker access for the doctor, and it potentially cuts down on errors, copying things down.
Makes sense. Faster, more accurate info usually means better care, right?
Precisely. And a lot of these apps aren't just data dumps. They have interactive games, personalized content,
Yeah.
stuff designed to teach kids about health in a way they actually, connect with, encourage healthy lifestyles.
Like a little health coach in your pocket. Okay, let's shift gears a bit. We've talked tech for monitoring and info. What about other areas, like say digestive supplements? Are there advancements there?
Yeah, digestive supplements are definitely an evolving area. The main focus is really on supporting gut health, which we know is closely linked to overall immunity in kids.
Right, the gut microbiome. And it feels like there are more choices now.
There are. You see everything from newer types of milk formulas boosted with specific vitamins and minerals to more organic nutrition options if that's what parents prefer.
Right.
And these supplements can be really important, especially in situations where, for whatever reason, breastfeeding isn't possible or isn't enough.
That's a really important point for a lot of families. Okay, moving to something really critical for the tiniest patients, infant ventilators. What's new there?
Oh, these are absolutely life-saving devices for babies with breathing problems. And the technology is getting, well, Smarter.
Smarter how?
We're seeing smart ventilators now that can automatically adjust the oxygen levels and the breathing support based on the baby's actual real-time needs, minute by minute.
Wow, that level of responsiveness must be huge.
It really can be. We're also seeing advances in specific ventilation techniques like high-frequency oscillatory ventilation, HFOV they call it.
Okay.
It's like delivering lots of tiny, rapid breaths. And there are also more non-invasive methods being developed, which are often gentler on fragile infants. Better outcomes.
And I heard something about portable ones, too.
Yes, portable infant ventilators. That's a big step. They allow for continuous respiratory monitoring, even if the baby isn't in, say, a major hospital NICU. It provides crucial support in, higher risk situations outside that setting.
That could offer so much reassurance. Okay, switching to older kids now, getting a fast, accurate diagnosis is always key. What's happening in pediatric diagnostics?
This area is moving incredibly fast. Just really impressive technologies popping up. Things like advanced imaging, much better blood tests, the use of AI, which we can talk more about, and more available genetic testing.
Genetic testing seems like it's becoming much more central, doesn't it?
It really is. In pediatrics, it can help pinpoint specific genetic markers for conditions like sickle cell disease or Down syndrome, sometimes even before birth or very early on.
And that means?
It means earlier diagnosis, which allows for earlier interventions and getting a really personalized care plan in place much sooner.
And it seems like the speed of getting results is improving, too.
Definitely. The rise of portable diagnostic devices is a big factor there. Healthcare pros can often get results and start treatment much faster, sometimes right at the point of care, which can make a massive difference in outcomes.
Okay, now something that sounds really sci-fi. Advanced visualization, like AR and VR, in hospitals.
Yeah, it's not science fiction anymore.
Yeah.
Augmented reality, AR, and virtual reality, VR, are actually being used more and more in pediatric care.
How?
Well, doctors can use them to get a much better handle on complex conditions. Imagine being able to see a kind of 3D visualization of a child's heart defect, for example.
Wow, like looking inside without surgery?
Sort of, yeah. It helps them plan procedures. And these 3D visualizations are also amazing training tools for medical students and surgeons to study complex anatomy.
That makes sense.
But it's not just for the doctors. AR and VR are also being used in really creative ways to help kids directly.
Like how?
Like distracting them from pain during shots or procedures, making physical therapy more like a game, or even just explaining a condition in a way a child can understand using visual aids.
That's brilliant. Such a clever use of that tech. Okay, let's tackle the big one. Artificial intelligence. AI. It's everywhere. How is it impacting pediatrics?
AI, yeah, especially machine learning and deep learning, is being applied in, well, tons of ways. A major one is helping pediatricians make better diagnoses.
How does it do that? Does it replace the doctor?
Oh, no, not replace. It assists. AI algorithms can sift through huge amounts of patient data, think electronic health records much faster than a human can. And it can spot subtle patterns or correlations that might signal a particular condition, sometimes earlier than might otherwise be noticed, helping doctors connect the dots.
So it's like having a superpowered assistant looking over the data.
Kind of, yeah. It provides insights. And AI can even analyze population health data to help predict trends, like maybe spotting an early outbreak of flu or identifying factors linked to preterm birth.
That predictive power is really something. Any other AI applications?
Oh, definitely. We're seeing AI-driven virtual assistants, sort of like chatbots, that can offer personalized health tips or even basic mental health support for kids and teens.
Interesting.
And behind the scenes, AI is helping streamline things in clinics, automating some data entry, optimizing appointment schedules, managing resources more effectively.
So it makes the system run smoother and hopefully frees up more time for actual patient care.
That's the goal, exactly.
Now, you mentioned electronic health records, EHRs. They seem pretty fundamental to all this data-driven stuff.
They absolutely are. Pediatric EHRs are basically the digital version of a child's entire medical chart. Everything's in there.
Like a health diary.
Pretty much. Past illnesses, treatments they've had, vaccination records, allergies, medications. It's all consolidated electronically.
And having it all digital must have some big advantages.
Oh, huge. For one, instant access to a child's history for any doctor who needs it. Plus, safety features like flagging potential drug allergies before prescribing something. That's critical.
Yeah, absolutely.
And it makes sharing information between, say, a pediatrician and a specialist much, much easier.
Yeah.
Better coordinated care.
And I guess all that data, when it's anonymized, is gold for research.
Exactly right. Researchers can use AI and machine learning tools to analyze these massive EHR datasets. They can spot trends in childhood diseases, maybe identify risk factors, track outcomes of different treatments. It really fuels medical discovery.
So better care now and better treatments for the future. Okay, one more piece of the puzzle. Clinic management systems. These sound more administrative, but important.
Very important for making everything run smoothly. Think of them as the operating system for the clinic.
Okay.
They integrate all the different functions: medical records, billing and finance, appointment scheduling, staff management, all into one
We're
system.
keeping everything organized.
Yes, which helps the clinic staff and administrators spot inefficiencies, avoid mistakes, and just generally run a tighter ship.
And does that help the doctors too?
It does, because these systems can provide doctors with important data summaries or alerts related to their patients, helping them make better informed clinical decisions. It all supports optimizing patient care.
Okay, so even the behind-the-scenes tech plays a big role in the patient experience. Wow, that's a lot of change. How on earth do pediatricians keep up with all this?
That is a really good question, and honestly, it takes constant effort. It's part of the job.
I bet.
Doctors have lots of ways they stay current. Attending medical conferences and seminars is a big one. It's where a lot of new research and tech gets presented.
Right, continuing education.
Exactly. Being active in professional organizations, like the American Academy of Pediatrics, the AP,
Hmm.
they provide guidelines, resources, journals.
Networking too, I imagine.
Absolutely. Online forums, discussion groups with colleagues, just talking to peers about challenging cases or new approaches. Collaboration is huge.
Mhm.
And of course, reading the latest medical journals, maybe taking specific continuing education courses online or in person. And some doctors are directly involved in research themselves.
So it's a real commitment to lifelong learning.
It has to be in a field moving this fast.
Okay, so we've covered a lot of ground, a lot of different technologies. How does this all fit together? What's the big picture for child healthcare?
Well, all these tools fall under the umbrella of health information technology, or HIT. And HIT is really crucial in building what we often call a medical home for a child.
A medical home. What does that mean practically?
It's about providing care that's comprehensive, coordinated, continuous, and really centered around the child and their family, not just isolated visits. And HIT makes that possible. It makes it way easier to share a child's health information securely between their primary pediatrician, specialists, hospitals, the school nurse, whoever needs it. Makes care much more seamless.
Less chance of things falling through the cracks.
Exactly. And HIT also empowers parents. It gives them more access to their child's health info, easier ways to communicate with the doctor's office, tools to track progress. It makes them more active partners in their child's health.
And we talked about some of those tools already, right? Like EHRs.
Yep, EHRs are central,
Hmm.
but there are others too. Personal health records, or PHRs, those are records the patient or parent controls.
Ah, okay.
Patient portals, secure websites, or apps for messaging the doctor, seeing test results, booking appointments, family-centered care plans that involve the whole family, e-prescribing, sending scripts straight to the pharmacy,
Right. Saves time, fewer errors.
getting summaries after visits so you remember what was said,
Uh-huh.
and systems for tracking referrals or lab results so nothing gets missed. It all works together.
It really does sound like technology, when used well, can create a much more connected and supportive healthcare journey for families.
I think that's absolutely the case. And, dedicated practices like Omega Pediatrics, they're actively working to integrate these advancements thoughtfully to give the best possible care.
And for us as parents, just knowing about these trends, understanding what's possible, it helps us ask better questions and feel a bit more in control, doesn't it?
It really does. And speaking of being informed, if you want to dig deeper into any of these advancements we've discussed today, or see how Omega Pediatrics is putting them into practice,
Where should people go?
we definitely recommend visiting omegapediatrics.com. They've got a lot more detail and resources available right there on their website.
Okay, great resource, omegapediatrics.com. And hey, if you found this conversation helpful, if you learned something new today,
Please do give this video a like.
yeah, like it, subscribe to the channel so you don't miss our future deep dives, and maybe share it with other parents or caregivers, who might find it interesting.
Well, thank you so much for joining us today as we explored some of these really exciting changes happening in pediatric care.
It's been fascinating. And maybe just a final thought to leave you with. Think about how these incredible tools, this technology, could bring you a little more peace of mind and ultimately contribute to even healthier futures for your kids. Something to consider. Until next time.
Goodbye for now.